Good afternoon. I am Suzanne Lawson with Constellation Consulting, and we are pleased to present the New Mexico 2021 Summit on Health Equity. The summit is funded by the New Mexico Department of Health Tobacco Use Prevention and Control Program and will take place throughout May on our event app with live sessions each Wednesday afternoon. For more information about the summit, please visit our website at nmhealthequity.org. Due to COVID-19, this year's Summit on Health Equity remains an online event. We appreciate those who have participated and supported this year's event, including the New Mexico Department of Health, our Summit Planning Team, Presbyterian Healthcare Services, Conalma Health Foundation, Be Well NM, the Santa Fe Community Foundation, and others. For a full list of our supporters and online exhibitors, please visit our event dashboard online or on the Whova app. I encourage you all to use this year's Summit on Health Equity event app. The Whova app provides you all with opportunities to network online, schedule COVID-safe meetups, create discussion groups, visit our exhibitors and supporters, watch recordings of sessions you may have missed, download files provided by our presenters, and more. It is a great tool for you to use not only during our live sessions, but also throughout the month. Plus, when you use the app, you can earn points, which could mean prizes. Please check the leaderboard in Whova for more information. For today's session, attendees' webcams and microphones have been disabled. If you have a question for today's presenter, please use the Q&A function within Whova, and we will address as many questions as time allows during the Q&A. Also, any materials provided by today's presenter will be posted as part of this session within the event app. For today's session, our presenter also requested 3 polls for our attendees to answer. It should have pinged you all when you came into today's session to answer those questions. So if you get a chance, please complete those polls for our presenter. If you need assistance during today's session, please utilize the Q&A feature or the Ask the Organizers feature in Whova. You may also try emailing us directly at info@constellationnm.com. Following today's session, we appreciate if you take a few moments to complete our session feedback by clicking Rate in this session of the Whova app. If you would like to request community health worker or social worker CEUs or continuing medical education units, please include your name and email address on your evaluation, and CEU certificates will be emailed out within 60 days. If you need assistance with CEUs, please email us at info@constellationnm.com. And finally, before we begin today, Constellation Consulting acknowledges that our organization operates primarily on the unceded ancestral homelands of the Tiwa-speaking peoples. Racism has no place in our communities. Constellation Consulting and our team members are committed to racial equity. We acknowledge and denounce the violence and discrimination affecting the Black and Asian and Pacific Islander communities with whom we stand in solidarity. We are New Mexico, and we were built strong by the diverse people of our communities. There are a variety of organizations supporting health equity throughout our state. We have listed just a few here and encourage each of you to seek out, learn more, and become involved with and support organizations who are building a better New Mexico for us all. Today, we are excited to host Nicole Hall, who is an assistant public defender in Aztec, New Mexico. Nicole started with the Public Defender's Office in November of 2018 and made the terrible mistake of going to a private firm in March of 2019, only to realize she was a public defender at heart. She returned to LOPD in November of 2019 and has been enjoying every facet of her work since then. In her spare time, Ms. Hall is the president of the local LGBTQ+ community center, Identity Inc., and has been organizing and leading others in the fight against racial and social injustices. In February 2020, Ms. Hall appeared in a national television show called We're Here, wherein she shared her story as a male-presenting lesbian who was continuously misgendered by the local judges. Please welcome Nicole Hall.
Hello, everyone. Thank you very much, Suzanne, for the introduction. As she said, my name is Nicole Hall, and I work for the Public Defender's Office Our office is located in Aztec, New Mexico, but I actually live in Farmington. Outside of work, I am the president of our local LGBTQ organization, and I do participate in as many social activism events as I can. So today I am here to talk to you about intersectionality and how different identities can affect different people. And I kind of wanted to relate some of that to the different geographical areas, because New Mexico is comprised of a lot of rural areas. So I think it's important to understand how all of those things can work together. We'll also go over some ways to discuss certain identities and how to talk about some of those things with your clients, with your patients, and I did add at the end, if we have some time, some laws that are kind of pertinent to the discussion that we are going to have today. So I want to start off with a quote. This is Kimberly Crenshaw. She is the person who has coined the term intersectionality. She first started using this term in 1989, so it is kind of an older term, but it's just come to light a lot more in recent years. And I do find that a lot of people conflate intersectionality with identity, but they're actually two different things. So Crenshaw coined this term because she actually she's a lawyer, and she took a case where they alleged that there was discrimination because the particular business didn't hire Black women. The business showed the judge that they hired Black men and that they hired women, and the women were all white. And so the judge ruled that there wasn't any discrimination because there were Black people and there were women that worked for this particular company. And so that is when Crenshaw took it upon herself to just try to make sure that people understand that, they didn't have any Black women. And so what she was not, it was not just a racism issue, it was also a gender issue, and people don't often put those two things together. So the quote is, intersectionality is a lens through which you can see where power comes and collides, where it interlocks and intersects. And I think her use of the word power in this quote is interesting because often with the word power denotes like strength, right? And so when we're talking about marginalized or minoritized communities, a lot of those people feel powerless. So I thought it was an interesting use of the word power. What I think I think the power that she's talking about is more along the lines of like a possession of authority or a certain amount of influence, right? I think that one identity can have a greater influence on a positive outcome or put someone in a better position of authority, while another identity could ostracize someone or, keep them from leveling up, as the cool kids are saying these days. So let's start, and I wanted to just kind of give you the definition of identity. It's kind of hard to define intersectionality, and I wanted to kind of do that throughout the presentation, but identity is the characteristics, feelings, or beliefs that distinguish people from others, right? And so I think everyone has these. They're no matter who you are, and all of these things can work together or work against each other, depending on what kind of situation you're in. And so the following slides we'll talk about identity and try to distinguish it from intersectionality. So these are some of the common identity markers. And so what I wanted to do here was I wanted to give you folks 30 seconds or so to write down how you identify yourself. Then I had the great idea earlier to try to put it in a poll. I didn't put all of these in here in the poll, but Suzanne was kind enough to put up some of the poll questions. So if you guys haven't had a chance, I'd like to give you some time to either write it down or answer the poll, just so we can kind of see where we're at and kind of compare and contrast even within this webinar.
So we do have some the poll results that had come in. So in terms of sexual orientation, it looks like we have a majority of heterosexual. We also have others who identify as lesbian, pansexual, gay, and then we have a few who have identified as other. In terms of gender identity, the vast majority of us are identifying as female. There are a couple identifying as male and also one identifying as genderqueer. And then we have on race, we have 6 attendees who have identified as white non-Hispanic, 4 who have identified as white Hispanic, and then ones who have identified as Black or African American, multiracial, or American Indian, Alaska Native.
Okay.
So that's where the polls currently stand.
Oh, great, great. So we have a very diverse group of people here, which is fantastic, because we're going to be talking about a lot of different identity markers. And so I think just listening to the poll results, it's quite obvious that, like I said, everyone has different identity markers, and I mean, they can range widely. And so even in the poll, you know, there were people that answered other, and that's just because the list that I gave Suzanne wasn't exhaustive. And so there really is just so much that can distinguish one person from the next. And we're just going to kind of go through that in this presentation. So this is a photo of a really busy highway intersection, right? And so this, I think, for me, was just kind of a visual aid to try to help people understand kind of what I mean by intersectionality, right? So we have all those identity markers that we just talked about. And so if you are, you know, driving on the gender identity road, at some point it can overlap with race or with ableism, any of those things. And so that is what we're talking about when we talk about intersectionality. How do those things react with each other? When do they overlap? And how does that affect people in society? So here's a clip from a study done by the University of Chicago. They did this in their School of Medicine. And what they did was they interviewed several people and asked them to just kind of describe, they first identified themselves, and then they were asked numerous questions about how it affects them in their daily lives. The interviews themselves were about 30 minutes, but they narrowed them down to just a few minute videos for their participants in the study. And I just took a couple of clips from some of those interviews. You'll see 2 here and then 1 later, just to give a perspective on how intersectionality has affected other people. So this is going to start.
Being African American has been the predominant identity in my life, not just for me, but in terms of the way people identify me and interact with me. The overwhelming reaction is based on the fact that I'm African American. And I think that's even a stronger issue for people than the fact that I'm a man. So race is really a very strong determinant of my interaction in society. I have never been in the LGBT community just a gay man. I've always been a Black gay man. And that has determined, in most cases, how people interact with me. For a very long time, Black men were generally not particularly welcome on the Strip, on Halsted Street, in the center of the geographic gay community. We were not particularly welcome in bars. And in interacting with men of other racial and cultural backgrounds, particularly white men, we were oftentimes objectified.
And so I wanted to play those clips because I feel like Don has a different perspective than what I have, right? So with the identity marker of age, he's definitely older and has had some different experiences and was able to just kind of talk about the way that those things have affected him back in the day, I should say. And so these are of those common identity markers, these are the ones that I feel, as Don said, are most predominant in my life. So I am Black, I am male presenting, I do identify as female, and I am a lesbian. And so in those things, you know, I want people to think about the identity markers that you either wrote down or answered in the poll, and just kind of how do you feel about how would you feel in certain contexts and certain situations. And so here I listed some of the contexts I think that I would say I feel unwelcome in, right? And so if we look at the top 2 bullet points and the bottom 2 bullet points, we can see where those are, you know, the context is there are white people there. And so I would feel less welcome just because I am Black and I am the minority in that particular situation. If we look at the top 4 bullet points, you can see where they're all heterosexual, right? And so of course, that particular identity marker for me would make me feel a little less uncomfortable or a little less comfortable in that particular situation. If we look at all of the bullet points, you'll see that everyone is cisgender. I am also cisgender, right? So that would make me feel more comfortable in that particular situation. And then you can see the difference between the male and the female in all of the bullet points. And the reason that I put them there like that is because although I am cisgender and I do identify as a female, I am male presenting. So in all female, you know, situations, I of course stand out because of the way that I do dress, the way that I do present myself. And then in male situations, although I might be wearing, you know, clothes or present myself in a way that generally men present themselves, in that particular situation, I still am a female. And so I would feel you know, uncomfortable in those situations. So with those identity markers, you can see how some can make you feel a little more comfortable while others can make you feel a little out of place. So there are significant differences in race and sexual orientation, like in the populations in New Mexico. And this in particular can have different effects on how persons with the different identity markers are able to adapt or interact with people in both professional and social settings. So I wanted to kind of go through some of the statistics. So in Albuquerque, you can see it's predominantly white Hispanic and white non-Hispanic. As far as the other races, they're, you know, less than 5% each. And the next slide, we can compare that to San Juan County. I mean, there is a huge difference. I mean, in the white non-Hispanic population is pretty similar, as you can see. There is a little bit less white Hispanics. They're less prevalent here, but they're still here. But the major difference you can see is in the American Indian and Alaska Native. And that's, of course, because of the reservation makes up a large part of San Juan County. And so with, you know, seeing the difference in this information, you can see that, you know, professionals in San Juan County have to just be more aware of the stigmatisms and disparities that are associated with American Indians and Alaska Natives in this particular area. And these are some statistics just about I chose just some random counties in New Mexico just to kind of give you an idea of the same-sex couples. So the right side or the left side are the households or the amount of households per county. And I got these off of the census. And the UCLA did a study on same-sex couples in particular areas. And it's not entirely, I wouldn't say to these numbers are 100% correct, because the way that they get these numbers are, you know, they call you and they ask you if you want to participate in a survey, and we know how many people actually do that. So, but based on that study or that survey and the numbers of households on the census in Bernalillo, you know, there are approximately 267,699 households, where per 1,000 households, there are 9.75 same-sex couples. We move to Santa Fe, they have a lot less households, but their average per 1,000 households is a lot higher. And in San Juan County, where I'm at, we're not too far behind Santa Fe, but significantly less amount of same-sex couples up here. And in Grants, they are very small in that county. It's over where Silver City is, but they have a higher average same-sex couple per 1,000 households than even we do here in San Juan County. So I think that particular identity marker for people that are a part of the LGBTQ community, their ability to adapt and interact with people is going to be a lot different in Bernalillo or in Santa Fe counties, because they're going to be around persons that are, they're going to have more of a community there. And so I think that people would feel more comfortable in social settings and things like that. And geographically, it's important because of what we'll talk about later is called minority stress, and we'll get into that a little bit later. These are some statistics just about socioeconomic status. So on the top, we're looking at how many households in Bernalillo County have broadband internet versus San Juan County, persons with bachelor's degrees, which I think is a significant difference. And then the per capita income, it's around 7,000, which to a lot of people may not be that much money, but to people out here, that's quite a bit. And then the political discrepancies between Bernalillo and San Juan County. San Juan County is 44% Republican. And the reason that I thought that that's important is just because, you know, maybe stereotypical, but generally people that I identify as Republican are more conservative, right? And so that's going to affect a lot of things, right? So the kinds of local legislation that's passed, the, you know, how much support that like local organizations and local businesses have, and particularly, I guess, from personal experience, you know, when we do any social activism things up here, you know, say for BLM or for the recent rise in hate crimes against Asians, not a lot of people show up and we don't get too much support. And I think that's just because of, you know, we are the reddest county in New Mexico. So it's unfortunate. And I mean, it doesn't stop us, but there's definitely a big difference. And then also with the LGBTQ community center that I ran, we survived a lot on donations just because we didn't have a grant writer. And so it was just hard for us to hold those events and get the money that we needed, just because there, you know, isn't a lot of support for the LGBTQ lifestyle up here. So we discussed some of the identities and like their prevalence across New Mexico and the differences in the geographical differences. So I wanted to take some of that information and tie it to health disparities and just the various ways that people can be affected by all of those things. This is another quote from Crenshaw. So it says, treating different things the same can generate as much inequality as treating the same things differently. And this one hit home for me because it really makes you think about how every person has their own identities, right? And being aware of that and acting or reacting accordingly, I think is equally, if not more important than trying to rid ourselves of the implicit biases that we have. And so you'll see in the next slides the importance of just not treating the same things differently. So these are disparities specific to race. Black Americans have the highest mortality rate for all cancers combined. Hispanic women are 40% more likely to have cervical cancer and 20% more likely to die from it. Adolescent Hispanics women in particular attempt a suicide rate at 40% higher. Asian Americans are 35 times more likely to contract tuberculosis, and American Indians and Alaska natives have twice the rate of HIV infection. And these are just some of the, hundreds of disparities that I read through. But these were the ones that I chose just to associate them with some other health disparities in race and kind of see how they interact. So these are the ones, or to compare the ones with race to the ones with LGBTQIA individuals and just see how they interact. So LGBT youth are 2 to 3 times more likely to attempt suicide, and that's likely because of their inability to have those support systems and things like that. I know that we had a at Identity, every Monday we had a teen group where kids from ages 13 to 18 could come in, and we had a licensed therapist talk to them. And on average, we had about, I'd say 15 people come in. And once we had to close our doors back in August and November, we got quite a few phone calls from parents just asking if there's any way that we could continue that. But COVID just would not allow it. And so we are working to get that back up and running, but we're hearing about how that's affecting a lot of the kids in this area. Lesbians are less likely to get preventative services for cancer. Gay men are at higher risk of HIV. Lesbians and bisexuals are more likely to be overweight. Transgender individuals have a higher prevalence of HIV and STDs. And then the last bullet is the LGBTQ populations have the highest rate for tobacco, alcohol, and other drug use. And so on this slide, I put them side by side, right? So we have the race disparities on the left, and then the LGBTQIA disparities on the right. And I wanted to show you kind of how these interact, right? So if we look at the top bullet, Black Americans have the highest mortality rate, and we follow the pink arrow, we can see that lesbians are less likely to get preventative services for cancer, right? So if we have a Black lesbian, then those two identities have compounded in this particular situation, in this particular instance, to create a situation where that person is more likely to die from, a cancer, because they are less likely to get that preventative care, and then are more likely to get diagnosed with late stage, or incurable. If we go to the third bullet point, adolescent Hispanic women attempt suicide at a 40% higher rate than their white counterparts, and we follow that tan arrow up, LGBT youth are 2 to 3 times more likely. So if we have an LGBT Hispanic woman, an adolescent, that person, because of those identities, also compounding here, they are at a greater risk of attempting suicide. So I just wanted to give a couple of examples. This whole slide will be in the materials, but this is just an example of how these different identities can compound and just create higher risks, health risks for certain people. So this slide I put on here because I wanted to relate it to geographical area as well. And I think in my research, I found it pretty startling that only 1/10 of the entire physician workforce actually works in rural areas. That's a pretty crazy number. I guess I don't know what the national average is, but yeah, I think that I found that interesting. And I listed some of the just general health disparities in rural areas. So for cancer, there's a higher incidence and mortality for cervical cancer in rural areas, right? So we talked about that Black Americans have the highest mortality rate for all cancers combined, and then that lesbians don't actually get a preventative care. So if we have a Black lesbian living in a rural area, that's 3 identities, right, that are compounding to just make the situation that much more dangerous. And that goes for kind of all of them. So if we look at the mental health, adolescent and Hispanic women attempt suicide at 40% higher rates. And just in general, because of the geographical location, that's also something that the CDC is concerned with in rural areas, because they just generally, people that live in rural areas have a higher suicide rate. So these things can all compound and just, pile up on top of each other, just create a situation where a lot of people are just not in good positions to take care of their mental health or their physical health and things like that. Let's see. Okay, so some of the disparities that we talked about mentioned that there was a particular group that was less likely to seek out help, and that can happen for several reasons, just lack of transportation or just living in isolation. And so I've listed a few negative experiences that other negative experiences that cause people to hesitate to do even just everyday tasks. So the registration systems and forms are lacking, and I've actually talked about that in my office. When we have applicants apply to the public defender's office, we don't, there aren't a lot of boxes for the different sexual orientations or for the gender identities. And so unfortunately, we kind of put them in a box when they apply for our office. Another thing is assumptions that spouses or parents of children are opposite sex. That experience is just in everyday interactions in my office, and I'm sure health offices, and I know in the daycare that I took my daughter to, that happened in that situation as well. So the next one, documents and materials reflect only heterosexual families and gender conforming individuals. That is something I think that is I experience when I go to the doctor, but it's also something that we experience here because we have paperwork that we give to certain clients that are alleged to have committed crimes against household members. And so those forms generally assume that the household member, if it's a spouse, is of the opposite sex. And I think, trying to work on changing some of that. Restrooms and misgendering, those are something that I deal with on a day-to-day basis in all different areas. I think my worst fear is probably going to the airport. For some reason, I always got searched when I went to the airport. And I learned from a friend that worked in TSA that when you are in that little machine that makes you put your hands up, that the people on the outside have to press a button that either says male or female. And they always just guessed for me. And because I wear a bra, maybe if they press the male side, then, there's all this extra fabric. And so I get searched. And for a while there, I just preferred to drive places. And, the same thing goes for restrooms. There's, been times where I've been accused of being in the wrong restroom, and all of those negative experiences just kind of, when you're out eating and you're like, oh man, I have to use the restroom, but you just don't want to. It just causes you to hesitate. It's just something that's always on your mind. And then microaggressions, those are, everyday slights and comments and things that people mean as compliments, but end up actually being discriminatory. And a lot of people, myself included, aren't really sure how to react always in those particular situations, especially in like professional settings. So those kinds of experiences can prevent people from going out and doing everyday things or getting the help that they need. So this is a list. This list is a framework that was introduced by Nicole Flemmer that she wanted to use to create kind of effective and therapeutic relationships to help people kind of create those things. And so we'll kind of go through a few of these on the next few slides. Particularly, it'll be this one is kind of the physical environment part of the framework. So, making sure that you use the proper symbols for acceptance. The first one, of course, is the Black Lives Matter. And that's very triggering for a lot of people across the country, especially in my area. The chief of police here openly calls BLM rallies anti-police rallies. So it's a very triggering thing. The second one was adapted to include all people of color. And the third one was also adapted to include people that identify as LGBTQIA. And so 4, 5, and 6 are the progression of the flags. And so in number 6, we have the most recent adaptation of that, which stands to include LGBTQIA, people of color. I think that you just have to be careful about, I guess I don't want to say be careful. I think it's just important to be aware what you want to portray, both the negative and both the negative and positive effects of maybe having any of these symbols in your office or anything like that. So this is part of the language, which is one of the elements listed in the framework. So the next few slides are going to go over language, because I think that communication is key, right? And that being able to communicate well, it prevents people from feeling alienated and allows them to open up to you a little bit more. So how may I help you? That one is there just because a lot of people do add the sir or ma'am at the end of that. And that misgendering that being the first thing that's done is a misgendering can definitely alienate people and make them feel unwelcome. It's important to remove pronouns when discussing the client. You can call them by their name, or even just being a time, I think makes me feel better. Your 2 o'clock is here. I feel better than that, than getting misgendered. Removing pronouns when addressing or referring to children or spouses. I think this is harder for people because most people want to say son or daughter. And it's probably kind of weird to say child, but I think we should, try to normalize just not assigning genders to people or kids that, we don't know anything about. And then body language and facial expressions. Those are the microaggressions that a lot of people just aren't aware that their facial expressions and their body language can really affect someone when they mention their sexual orientation or anything like that. So it just got to be careful with those kind of things. So when speaking to clients or patients, I always ask them if that is the name that they prefer to use, the name that's on their file, because, for us, they're required to use their government name. And so I think it's important to just say, is this the name that you would like me to use, or what is the name that you were given at birth? And these things are, can spark a number of different questions. And I always make sure to tell them, that if they don't want to answer any of my questions, they don't have to. And then I also tell them that if there's any other questions that they do answer, that they want me to keep confidential, just let me know. Because I actually had a client who was victimized by his mom. He had just come out to her, and they had a big, huge argument. And then he had a couple of drinks before he went to tell his mom. And so when he left the house, she called the police and said her son was drinking and driving. And they did arrest him, and he did blow up a .06. But I, wanted to ask him if it was okay if I disclosed that information to the DA, just to see if I could get the case dismissed. And we did have a positive outcome in that case. So, sometimes it can really help to just kind of get them to open up about some of this stuff. So sex and gender and pronouns questions, those can spark a number of follow-up questions too, just so you can try to understand who your client is and where they're coming from and what kind of experiences that they've had. If you if you ask the questions, are you in a relationship or do you have a partner? Those are questions that you're assuming, where you're not assuming the sex or gender of the spouse. And then, of course, always ask questions if you feel like you need more context. You told me you identify as, demisexual, and, demisexual, they can be bisexuals or straight or gay. And so you might need some more context or some more information on that. So don't be afraid to ask those kinds of questions. So empathy was one of the things, one of the elements listed on the framework as well. And I think just understanding where a person is coming from and their experiences, you're able to kind of draw from your own experiences and create that like empathetic connection with your clients and your patients so that they're feeling more comfortable in that relationship. And here's a clip just again from the study from the University of Chicago, just kind of outlining that.
My name is Vita. I identify as a Black, trans, non-binary, mentally disabled. As far as sexual identity is concerned, pansexual, demisexual, femme person. Yeah. Well, one of the ways I think being a Black pansexual trans woman affects my hypertension directly is stress. I hadn't had like super high blood pressure really until I had come out. And I've had to be on a blood pressure medication since coming out because my blood pressure has just been that high. I'm wagering it's stress related, just from it's a mental exercise to leave the house now, you know, and to feel confident enough that you would get from point A to point B and back to point A safely. And like even today when I was getting ready to come here and I was getting ready to decide which clothes to put on, that played a huge role. And I could feel just my heartbeat going so fast, so fast, so fast. And it's like that pretty much all the time now. So yeah, I think it directly plays a role in that, especially with someone with stress-related mental disability as well.
And so in that particular segment, it kind of brought out some questions that I think I am going to start asking some of my clients, just to try to create, to get a sense of what their experience is like. And like I said, just be more empathetic with them. So the types of questions that I thought about were, you know, how have your identities affected your upbringing, your social interactions? How have your identities affected your career prospects? Have you ever felt discriminated against or anything like that? Because that could be, you know, part of the particular case that I'm working on. And then have you ever felt like you needed to conceal any one or more of your identities, and how often? Because that can also create a type of stress that, I mean, can just compound situations. So I think the biggest thing for me is just trying to build that trust with my clients, because it's important for me to know just as much as I can in order to, you know, represent them adequately and accurately. And so I try to make sure that I'm doing these things, just, you know, trying to be as compassionate as I can about the particular situation and making sure that I'm actively listening, so they know that I actually do care. But I also, you know, try not to ask too many questions. I don't want them to feel like I'm probing. And in particular situations with LGBTQ clients and patients, it's if you're asking too many questions, and they would kind of get the feeling that you're wanting them to educate you. But I think that it's important for everyone to educate themselves. But you can ask questions about, you know, the things that you've learned, right? And particularly, I wanted to include some of these ways to be an ally, because I think that even to be an ally outside of the office, because I think that if you are an ally outside of the office, then a lot of these things are going to become second nature for you, you know, in a professional setting. And I think that that's helped me a lot with the Native American community up here. And so, you know, pronouns, those are the biggest things that I do, is make sure that I ask someone what their pronouns are, and apologize if I make a mistake and call them by a different pronoun. I try to be inclusive in speech and writing, and at events and establishments, you can designate a gender neutral bathroom. And then I think the other thing, which I think is more important here, just because I do have a lot of friends that are white. It's a predominantly white area, and there are some stigmatisms and discrimination against the Native American population up here. And so I think the biggest thing that I do is to speak up when you hear those anti-race or anti-LGBTQ conversations going on, so that you can, you know, correct any, I guess, misconceptions, or you know, let people know that what they're saying is hurtful. For LGBTQs, though, the biggest thing is don't out someone. which is why I thought it was important to ask my client if I can, disclose that information. You never want to assume a person's gender identity or sexual orientation. Misgendering, I think, is more painful than people understand. This one, born boy or girl, right? I think if you say it, were you assigned male or female at birth, like those terms recognize the difference between sex and gender, right? And emphasize that these are assigned to an individual rather than them being like innate and, a binary kind of thing. So I think it's, saying, were you assigned a male or female at birth is much better. And then avoid trying to make someone put a concrete label on their identity. Everyone hates being put in a box. And so that's why on the polls, I made sure to put other, just because, I didn't list everything. And even if I did, there could be another way that someone wants to identify themselves. Racial allyship. So this statistic I thought was interesting. 75% of white Americans don't have any non-white friends. And so that is, that number was just really crazy to me. But to be an ally, you want to, be aware of your implicit biases. I think making ourselves aware of those create an opportunity for us to discover ways to I guess diminish them. Implicit bias training is extremely helpful, but it only works for a certain amount of time. So that's something that you have to continually work on. You can become involved in social action. You can ask about different cultural customs and traditions, and that's something that I've had to do quite a bit here in San Juan County. I didn't have any interaction with Native Americans before I moved here. So I am learning quite a lot about that. And it's really helping me be able to connect with my clients. So yeah, these are all that, watch films, listen to new music, read up on stories. There's a lot of, video blogs and a lot of bloggers out there that can kind of give you an insight on, people's experiences depending on what their race is. Don't be silent. I think the saying these days is, silence is complacency. And so, the privileges that I do have, I like to use them for the benefit of others, just to try to end some of the racism that is going on in this particular area. Another thing is shifting the focus to another cause. I think that's done quite a bit when you're out at a social event for a particular cause, and it's, oh, well, these people also, deal with this or deal with that. And I think that takes away from the cause that you're at itself. And then kind of, as a person, you kind of lose credibility on whether or not you actually want to be there. So it looks like we're a little bit out of time. So I think I'll skip some of these laws, but I did want to talk about this one. This was the most recent one, the New Mexico Civil Rights Act. Under this, the main thing they wanted to do was just to be able to hold police officers accountable for some situations where they feel like there was also that people's rights were being violated because of race or sexual orientation, things like that. But what this law actually did, in addition to that, so that is something that can be done, but it also says a public body or person, right? So that opens it up to a lot of different organizations, mine in particular, right? So the Public Defender's Office is a state-run organization. And so if there's anything that I do, or teachers, or anyone that works at state-funded health places. I mean, any of those people are kind of open to these kind of civil lawsuits now, which I think is very important, because then it makes people aware of how they're, acting and reacting in particular situations based on someone's identity. So yeah, I think I just wanted to leave this quote with everyone, just to make sure everyone, stands up for what they believe. And I appreciate you guys being here. So thank you very much.
Thanks so much, Nicole.
Yeah, of course.
As a reminder for our attendees, if you have any questions for Nicole, please submit your questions through the session Q&A tab or the chat feature in Whova, and we will address as many questions as we can in the time allotted. I know we're approaching the 3 o'clock mark, but we do have a few questions, and so I do want to see if we can address a few of those.
Okay.
So we had a couple of questions that came in through the Whova app prior to the session. And so I'll touch on those first. So it says, it seems like many of the professionals in our rural and frontier communities are, quote, outsiders, having come from elsewhere. Does that factor into this discussion at all?
Well, I think that it's really important, because, like I said, when I moved here, I hadn't had any interactions with any Native Americans, and so I think it's very important for the outsiders when they're coming in to just try to understand the different identities and their prevalence in that particular area, because that's going to determine how, in I guess in the healthcare setting, how their relationship is going to be, and what kind of things are affecting this person's health in particular. Is it, if it depends on their race or their sexual orientation, the prevalence of drug use in that particular area. I think all of those things come into play. So it's important for an outsider to come in and kind of do the work to understand the types of clients that they're going to be dealing with.
And do you have any recommendations for the best places to go to learn about culture or specific issues in New Mexico?
Well, I am, I've been in New Mexico for 2.5 years. And I really don't have any suggestions for that. I guess in particular, for me, it's just been, being here and going to events and talking to people and making friends and making connections. Those are, for me, those are the ways that I've been able to more understand the area that I live in.
Okay, thank you.
Mm-hmm.
Another question that we had come in, and it says, can you explain? I'm going to change it to, can you speak to the power dynamics between the different races in San Juan County?
So, I mean, yeah, it's not great. So there is a lot of, I guess I haven't dealt with it personally, but there are a lot of my Native American clients do feel like they are targeted and discriminated against because of because they identify as Native Americans. They and then and it's mostly by the officers. And so that there's that, and then it's also the other way around. I think that a lot of the people in my office are majority a white, and they are feeling like a lot of the clients are not trusting them, right? Just like have a lot of distrust for them because of their status as, they identify as a white person or they are a white person. And so I've had to take a couple of cases where, I would just be able to relate to them because I am a person of color, and, they're refusing to speak to someone because they're feeling distrust in that particular person. there isn't a lot of hate crime. I did have a slide about hate crime in New Mexico, and there really isn't a lot here. But I think it kind of goes both ways in my from my perspective, in my context. And then we do see a lot of there is an odd power dynamic that I haven't really gotten too much into when it comes to like oil field workers, and that's just something that I have been getting into outside of work, and so I can't really speak on that, unfortunately, just yet. But
Okay, thank you.
yeah, of course.
We did have a couple of comments. Somebody was sharing their story of almost being kicked out of the airport restroom because the cleaning staff thought they were a boy. We have somebody who said, great ideas for greetings and contacts. Thank you for sharing that. Rosa Gallegos Zamora, who actually presented earlier this month, says that she works with LGBTQ plus individuals and she loves your questions that you're adding to your work with clients. She would love to incorporate those with her clients too. Are you willing to share those via email?
Yeah, absolutely, of course.
We can also, if you want to forward them to me, I can also post them in the session description so others can have access to them.
Yeah.
Rosa also adds that those questions are also helpful in writing their letters of support for gender affirming procedures.
Mm-hmm. Yeah. Yeah, I think it's important to try to use gender neutral or gender neutral questions, or try to be gender neutral in your conversation. And same with sexual orientation neutral. You don't want to make those assumptions. I think it's off-putting when those assumptions are made. So I find it very important to do that. And so trying to spread the word and make it the normal thing.
Sure.
Yeah.
Well, thank you so much, Nicole, for your time and your expertise today. We appreciate all of your efforts towards creating a true health equity in New Mexico.
All right. Thank you, guys.
We also want to thank all of our attendees for joining us today. Please remember to check your event dashboard for more information about our upcoming session, including today's panel on equitable policy development with Derek Lynn, Marshall Martinez, and Dr. Jennifer Gomez Chavez. Have a great afternoon, everyone.